My pleasure to be here. And one of the things, as you could see from a CV, that when you are of a certain age, you like talking to the younger generation because that's inspiring. That's good for ideas, because you guys have the greatest ideas, but it is also to try to motivate you, in terms of as you are thinking about what to do next. So one of, Tom said I should talk about my path, my journey, and he gave you a little bit of insight into how I started as a clinician in India. So from pediatrics, I was fascinated by neurology, went in to do pediatric neurology, did the clinical and the research thing, and then I think it was the fascination on how do we take evidence, how do we take clinical medicine, and this is what you have been talking since morning, into policy in change, ultimately from a individual level intervention to a population level intervention. That's what fascinates me. And I'll show you a couple of things, as I walk through my presentation to tell you why this is important. Why do we need to have that policy angle as part of our thinking from the beginning, and not something like what I did, 10 years in my practice, and then I went into policy. We need you guys to be the leaders in the country, together with the clinical and research work that you do. So, thinking about a good balance of 30% clinician, 30% researcher, and 30% policy. Simply because in many of the low and middle income countries, we don't have sufficient number of specialists, and you need to wear those multiple hats as you think about your career path. So this is the brain health unit. It's smaller than any neurology department you will have in Liverpool. I don't know, Tom, how many people there are here? Hundreds, right? So it's very small, and one of the things, the brain health unit, it is a newly established unit, and this is one of the, as we think about the leadership, this is about prioritization and recognition of brain health in the global public health agenda. It's not like infectious disease. Infectious diseases are sexy. You talk about vaccination. Nobody wants to talk broadly about all the neurological conditions, brain health. This is something that we are starting to talk about now. Now, I don't know, one of the things I have been criticized that I'm discriminatory. I have more women than men in my team, but that's fine. I think it doesn't matter. And it's great to work with women. I'm sure many of you will agree. And one of the things here is about within the unit what has been also very important, that establishment of the unit is as an indication of why neurological conditions are considered important by the World Health Organization. So I don't know how many of you seen the recent global burden of disease analysis of neurological diseases. You can raise your hand, left or right, or both, if you have read it more than once. Okay, very few. So the link is here. You can go on to the Lancet Neurology and look at the latest analysis that we did around all the cause categories in the global burden of disease database. Okay, before I go into how many of you know about global burden of disease, GBD? Okay, not many, but many of you know. So basically this is, when we talk about burden of health conditions, it's about comparability. We should not be, you have various prevalence studies, epidemiological studies, and you should not be comparing apples with oranges. So what this global burden of disease study takes all the health conditions, as many as possible, and then looks at through the, there are two units. One is in the years lived with disability and years of life lost. So mortality and morbidity, can look at calling it as a disability, and then calculates the burden. And now when we look at neurological disorders, as we know, You can, for example, if you're thinking about meningitis, you can call it a neurological disease, or you could call it as an infectious disease. So how do you capture it? And so same is true for many other health conditions, like let's say traumatic brain injuries. Where are you capturing as a trauma as the cause, or the brain injury as the consequence? So what we did in this analysis is looked at the causes and the consequences wherever a nervous system was involved. And the number, I think that's something for us to remember who are interested in neurology, that 43% of the world population experience nervous system loss. That's a huge number as we think about it. I think if I ask everybody, you would know somebody, or you would have one of the neurological condition, or are a caregiver of a person with a neurological condition. So that this impacts all of us. And so it's more than 1 in 3. So it's kind of huge numbers. And if you look at on the right-hand side, it's across the life course. So things like neonatal encephalopathy, prematurity, infections that can happen across the life course, dementia, Parkinson's disease. So the burden is in, maximum burden is in low and middle income countries, 80% of the burden, and it is just because 80% of the world's population live in low and middle income countries. And you can see some conditions impact male more and some impact female more. What is also important is to think in terms of what has been the demographic change over time. So while, mortality has been coming down as population is aging, the YLDs due to neurological condition has been increasing. So there is much more burden that we see than what was being seen in 1990. That was why 1990? Because that was the first time GBD data was analyzed. And now, just to say, GBD does not comprise all infections. It comprises some, so meningitis, encephalitis, and you can find the list. And you can look at the numbers in terms of where it is in the overall ranking, where it is in the ranking in a specific region in your country. So that's a fascinating set of data that will be helpful. And why this is important? I talked about policy making. This is important, okay, which vaccinations we need to talk about, what kind of surveillance systems we need to think about, what kind of management, diagnosis, treatment, and care systems that we need to think about. Another aspect when we start thinking about from a policy, what are policymakers interested to know? What are the numbers? So GBD is one number. You can have epidemiological data, you can have surveillance data. The second number, they are interested in what is the cost. So what is the cost due to the illness, cost due to inaction, and also what is the return on investment? And that's why when we are thinking about neuroinfections, these are hugely important, because we know we have lots of cost effectiveness strategies as we start thinking about all immunizations, antibiotics, etc., or antiviral therapy as relevant. Now, this again, data is very important from a policy-making perspective. Coming on to the second part of the equation, neurological disorders, huge burden, high economic costs. What is being done? What resources are available to tackle that burden that is due to neurological conditions? Now, this is the global numbers that I'm going to talk about, but I'm sure people coming from low and middle income countries, they will recognize that. If we think in terms of workforce, if there are 7 per 100,000 neurological workforce in high income countries, there is only 1 per million in low income countries. So there's a huge disparities as we see in terms of neurological workforce. So those of you, for example, coming from countries in Africa, like for a 24 million population, you will have 4 to 6 neurologists, or sometimes even lesser. And then all of these neurologists are practicing in capital city or in urban cities. And that is not only true for low income countries, that is also true for middle income countries, high income countries. So there are The message I'm trying to give is there are low resource settings everywhere. So rural urban disparities, indigenous populations. So why, even if you're practicing in high income countries, there are going to be those low resource settings. And so remember this, that these strategies and the implications of these strategies are relevant across the world. And so that's workforce is, of course, it is important. The second is in terms of the access to medications, access to diagnosis. There have been studies like for dementia in a country like India, there is 90%, only 1 in 10 person with dementia receives a diagnosis. If you look at high income countries, the data is not very good compared to low income countries. For example, in UK, the dementia diagnostic rate is only 50%. So there are huge diagnostic gaps that we see for many of these neurological conditions, and then access to medications. Now, one would think medications like levodopa, carbidopa should be easily available, but they are not. Only 1 in 3 countries have levodopa, carbidopa available at primary healthcare settings. So there are, and what it leads to is a huge treatment gap. For example, for epilepsy, 75% treatment gap seen in many low-income countries, and which is unacceptable because these are the cost-effective strategies. You can have 70% people seizure-free if these medications are provided. And I'm not talking about the newer medications. I'm talking about phenobarbital, phenytoin. These are also not available. So this is a landmark resolution for neurological conditions. Thinking about the burden, the cost, lack of resources. This was the first time in the World Health Assembly that this action plan was endorsed. So what does that mean? World Health Assembly is comprised by all member states. So 194 member states, all of them came together and say, yes, we need to do something about neurological conditions. And that resulted in an action plan. And so next few slides, I'm going to talk about what action plan is and why I'm talking about this action plan. That as you think about policy change, it provides direction, it provides actions that one can take at country level. These are relevant for all neurological conditions, including neuroinfection. So whatever area you are working in, see how this is applicable to you, and also think in terms of what you can do. So this has action for countries of the member states, it has action for WHO, and it also has action for partners, and you all are partners, you know, so everybody has a role to play, and this is, and you could play a role in one of the objectives. So this is very relevant as we start thinking from a policy perspective. So vision is about valuing, promoting, protecting brain health, preventing, diagnosing, treatment neurological disorders. And the most important thing is it is a people-centered approach. So that people with these conditions and their carers attain the highest possible level of health. I think that's something very important. And this is what we are talking about, even when we are thinking about our day-to-day clinical care. We want that every person receives the best quality, highest standard of care that we can provide. There are 6 guiding principles. So I mentioned already the importance of people-centered care and the approach taking a primary health care. And now why that is important. Lack of resource, lack of human resources, lack of financial resources. We cannot have specialists, and even at least in my lifetime or Tom's lifetime, or even your lifetime, if we are doubling, tripling, or even 10 times increase the number of specialists, look, remember the burden, 43% of world population. We are not going to reach everybody. So what we need is investment in primary healthcare approach. So we need to strengthen our general practitioners, our nurses, or other categories of healthcare providers like community health workers, clinical officers. They are known by various names in various countries, and that's what we need to strengthen. The second it talks about is the integrated approach to care across the life course. So I don't think I need to tell you about the importance of life course. We know that from an angle of infections, it affects everybody. Integrated approach to care is also, there is gradually more and more trend that is going towards, okay, even in a neurology, there is no general neurology anymore. We have people, epileptologists who are dementia experts, who are movement disorder experts, who are neuroimmunologists. And so there are lots of different expertise that are, the neurologists are taking, which is important. I think that I'm not saying on neuroinfections, which is important, but let's not forget the basics. Again, we are not never going to have sufficient number of specialists. So we need to take an integrated approach to care, also because of comorbidities. For example, epilepsy and infections, they coexist. They are important. Evidence-informed policy and practice, that's what we have been talking about. Intersectoral action. So again, this is important because as we think about the consequences, it has, let's take children. It has consequences for their education, employment. So we need to take an intersectoral approach. Sports, for example, if we are thinking about any of the neurodevelopmental conditions, how do we have inclusive environment? Empowerment and involvement of persons with neurological disorders and their carers. I think that's extremely important. Nothing for them without them. And I think the SDG goals, Sustainable Development Goal of leaving no one behind, that's extremely important. And gender equity and human rights. I think these are very much interlinked. So these 6 principles are extremely important from a policy angle. So if you are talking to your ministries, if you're thinking about programmatic strategies, these are the guiding principles for any program that needs to be designed at a national level. And so this can be easily translated from a global level to a national level, even at a subnational level. So this will be an important message that I would like all of you to take back as you start thinking about your next career path. The action plan has 5 strategic objectives, and I'm going to walk you very quickly through these strategic objectives. It has targets because as we know, what we don't measure doesn't get done. So measuring it is extremely important. Now, these are 10 targets you may think are very little, but even countries to give data on this is very limited. The capacities are very limited. So that's why this is the importance of data, and we actually have information system as one of the strategic objectives. So the first one is about prioritization and strengthening governance. So it's the importance of financing. Money is extremely important. So we need to have inclusion of neurological conditions in health insurance packages, health benefit packages. We need to have policies, plans, and legislation. So not many countries have a national neurology or a brain health plan. I mean, I can count them on fingers, and there are not even 10 countries which have a national brain health plan. And legislation that needs to be protective, and we need to advocate. And I think that's what we should all be. We should be advocates for neurology or whatever health condition that you work on within our countries. The second strategic objective is about effective, timely, and responsive diagnosis, treatment, and care. And there are 4 action areas: care pathway. This is about, we need to have a continuum of care, and referral systems, emergency, chronic care, continuity of care, which is something I'm sure you know much better than I do. It is about medicines, diagnostics, and health products, the access to medication, access to diagnostics. I mentioned earlier the huge treatment gap that we see due to lack of access to medicines. Health workers' capacity building, and the importance of building the capacity of primary healthcare workforce, because we lack specialists, but we also need to build the capacity of specialists. So I think courses like this are very important. And I think it's important that we are able, thanks to the course that Tom, you are running, is to get everybody together and to build their capacity in neuroinfections. And we need to more and more of these courses to happen. And about the supporting the caregivers in the family and the families, that is extremely important. So let's not forget that as we are managing, treating a person with a neurological health condition, that we need to take care of the family also. That's extremely important part of the work that we do. Promotion and prevention, and it has areas like trauma, environment, infections, promotion of brain development, and I think this is promoting healthy behavior. I don't need to talk about it because this has been touched quite a bit during the whole day. You know, you heard about the vaccination strategies. You heard about mitigating the risk of emerging infectious diseases. So these are very important public health strategies. And so that's when we are working in the area of infectious disease, the public health strategies are extremely important. In fact, the whole public health movement started from infectious diseases, and it is now encompassing to include the non-communicable diseases, mental health issues. Research and innovation, again, will be preaching to converted if I talk about the importance of research and innovation, and strengthening the information system. So while we are fascinated by doing epidemiological studies, I think what is very important is strengthening the routine health information systems in the countries to get better data. Why? Because you can have continuity of data, you can examine the data, you can look at the trends, and this is where more investment is needed by donors, by doers in the countries to have that change that we need for data at a country level. Right. Now this is why. So you will ask me, why do we have a strategic objective on epilepsy? And the reason is complicated. But let me try to explain. This whole thing started with an agenda item coming in the World Health Assembly to have an action plan on epilepsy. So some countries raised the issue. Okay, today epilepsy is important. We can have an action plan on epilepsy. Tomorrow somebody will come and let's have an action plan on Parkinson's disease. Day after, somebody will want an action plan on multiple sclerosis. Can WHO have an action plan that looks at all the neurological conditions? We said yes, makes sense. And that's how, because it started with epilepsy, so the name became epilepsy and other neurological disorders. But this is not about epilepsy. It is related to all the neurological conditions that we need to think about. Now, how are we translating this action plan? And I'm going to just focus on two messages here. You have heard me speak about integrated approach, and there are many levels of integration that are important. One is different neurological conditions. I have already talked about it. The second is continuum from promotion, prevention to rehabilitation and palliative care. The third is working with other sectors like mental health, non-communicable diseases, social determinants. Fourth is across the life course, and fifth is health and social care system. So these are extremely important, that let's not have one way of thinking, but let's think in terms of Venn diagrams and work with various groups. The second is that we need to think in terms of optimizing the brain health for better brains, for improving the benefits across different health conditions, social economic benefits, enhanced well-being. So we have a document that you can find on our website, Optimizing Brain Health Across the Life Course, which is taking that promotive aspect. I think it's a currency that we need to talk about, the brain capital. It's about how do we move from talking about managing neurological conditions to promoting brain health, and this is something that needs to be done across the life course. We should not be only talking about brain health when we start thinking about end of dementia and other issues. Right. So shifting a little bit, okay, what are we doing in WHO? And I'm going to talk about some of our activities and zero down a little bit on the work that we do on brain infections. So all of this is translated into some of our leadership and advocacy efforts. As WHO, it is important that we come out with guidelines, tools, technical products. So these are some of the things that we do. Third is about rolling these out in countries, supporting countries to improve their services, improve their care mechanisms. Fourth is monitoring, I already emphasized. And the last point is partnerships, working together with everybody. So the advocacy strategy for brain health. I think I have touched upon this, the importance of why do we need to raise awareness of neurological disorders. We need to start thinking about underserved populations, underserved conditions. There's a lot of stigma that is seen against people with neurological disorders, and we need to advocate on multiple levels and build upon many of these efforts. And as I said earlier, this is what I would like all of you to be advocates for, brain health advocates for neurology. The second is we need to invest in better monitoring of what's happening, better monitoring in terms of what is the epidemiology of health conditions, but not only that, what kind of service coverage do we have for various interventions? Is this acceptable to the communities? Is this appropriate? And some of the things that we do is having this global status report, but monitoring is an important part of policy that all of us should be focusing on. One of the work that we do is, as I mentioned, is working in countries, supporting countries. So it is mainly low and middle income countries that we support, but also we work with high income countries. So for example, since you mentioned Norway earlier, Norway is updating their brain health strategy. So we are working closely with Norway as they are updating their brain health strategy. I mentioned the importance of access to medicine, and this is something that we really focus on that we have. How can we work with, how do we do the analysis of where are the gaps? How do we support countries to improve access to the various medications? We have been working across a few countries in updating their essential medicine list, and then working with the regulatory authorities to ensure that the medicines are available. All of this we do through some of our technical products, and one of them is an implementation toolkit that we are developing, we are offering to countries. This is going to be launched on 8th of July, so if you are interested, we'll be happy to give you the link to the launch and then share. You can download it from our website. It is about, again, the policymakers, the program managers, how can they take IGAP and implement it in their country level. There are various tools that are available. These are, if of interest, you can find them. They are for various health conditions, epilepsy, Parkinson's disease, dementia. So whatever are the priorities of the countries, there are tools available that can help countries to implement action at country level. I promised that I'm going to come back to some of the work that we do in the area of brain infections, and I reserved this for last. So in WHO, brain infections are important, and they link to various programs within various arms of the brain of WHO. So of course, brain health unit, brain infections makes sense. Then we have immunization teams. We have emergencies, health emergencies team that are important. Brain infections have consequences. We have rehabilitation team. We have global arbovirus initiatives. You're thinking about antibiotics. We have the people working on medicines. And so there are various collaborators. When we're thinking about antibiotics, there's the issue of antimicrobial resistance, AMR. So we have colleagues working on that. So there's a large number of stakeholders that are important and that we work within WHO. And these are the stakeholders, if I think at national level, are also extremely important. So from a policy angle, if you're thinking about neuroinfections, these are the kind of the stakeholders that you need to think at a national level also. So, you have specific health conditions like tuberculosis and tubercular meningitis. So all of these preparedness is extremely important. Colleagues working on child health. So we need to have this broad stakeholder group when we need to think in terms of the strategy about brain infection. So some of the examples from our side have been the guidelines like for neurocystic psychosis, Zika, COVID-19. So these are some of the examples, some of the work that we have been doing in the past. An important strategy of interest is the defeating meningitis roadmap. And this was because we need to eliminate the bacterial meningitis. We need to read in epidemics, you can't eliminate all bacterial meningitis, but we can eliminate the epidemics. And we need to decrease the deaths and reduce the number of cases and improve quality of life and reduce disability. So these are the visionary goals. And this was the first time in neuroinfection world, in meningitis world, that the attention was not only on immunization and surveillance, but the attention was also on diagnosis, treatment, and care, including for people who have sequelae or consequences due to meningitis. So there are 5 pillars, and we are working together with our colleagues, I mentioned earlier, in terms of various strategies to help countries to have a world free of meningitis. I'm not going to talk about everything that's being done, but a couple of things about meningitis diagnosis, treatment, and care guidelines that we are developing. So this is looking at all acute bacterial meningitis, covering epidemic and non-epidemic settings for both children and adults. And the guideline there is a methodology that we follow using the GRADE methodology, and looking at issues for various from CSF testing, from blood testing to adjunctive therapy, antimicrobial therapy, as well as management of sequelae. So many countries have their national guidelines. For example, NICE recently released their guidelines, but not all countries in the world have these guidelines. So why having a WHO guideline is important? Because it doesn't make sense that every country is investing resources in making their guidelines from scratch. So what many countries do is have a WHO guideline and adapt it to their national settings. And so this is extremely important and efficient way of having these recommendations that can be used within the countries. We are also taking forward the work on encephalitis. There is a technical brief that we are working on. So thanks to the support by Encephalitis Society. So this is again will be very important. And this is linked to the defeating meningitis work that is happening. The other part that we are doing is looking at the sequelae. And one of the things that we realized, there is limited data. So what we have done is the brain infection global work that is happening in Brazil, Malawi, and India that was coordinated by University of Liverpool. We are seeing the following of these cohorts and to see what are the sequelae, what is the burden on the families, and the access to medical and social services. So this is an example of partnership, and that we need to focus on. That as WHO, we can't do things alone. We need to work in partnerships. We need to work together with civil society. We need to work with research institutions. We need to work with academicians, and we need to work with all of you. And that's where this lecture was important for me, was to see that how can we enhance partnerships and collaboration, especially with the young people here. So that's my last slide. Thank you very much.
Thank you very much. Okay, so we've got some time for questions. You come here, you're speaking. We've got some time for questions and comments and discussion if people have questions. I mean, maybe I'll start by asking you, you've presented a fabulous array of activity in many domains. Which do you think are going to be the biggest challenges, and also which are the quick wins? Maybe especially in the area of brain infections or more broadly.
In terms of which are the biggest challenges that we see at a country level, The biggest challenge that we see is in terms of the policy planning, and that is in terms of countries to have a standalone, a strategy or on brain health or neurology, because more and more countries are moving away from having a standalone. If I look at the other way, the quick win is to see that neurology is well reflected in any of the existing strategies or policy or a plan that a country has. So many countries have a non-communicable disease strategy. They will have a health strategy. So we need to see that neurological conditions are well reflected into that. So that's, I think one. In terms of the second point is about when we are thinking about these continuum of services and the referral systems, as we are talking about building the health worker capacity, access to medicines. I see access to medicine and health worker capacity as something that that will be a quick win, because these are something that are clearly understandable. There is a clear impact that we can see, and things can move, because also they can be interlinked to some of the other initiatives that are happening at a policy level. Where I feel there will be a lot of difficulties and challenges is in relation to strength, the health information systems, the data part, because that is something we still don't have much of capacity to capture data that is needed for policy making. So there are areas that where we can work with other sectors. There's a much more progress we can make, and those are the quick wins. And I would feel that for infections, for neuroinfections, I feel that they could be actually the entry points for many of the neurological conditions we are talking about. If we can demonstrate that neurological infections can be well managed, diagnosed, treated, and cared for in primary healthcare system, that can provide as an exemplar on how other services can be strengthened.
Other questions or comments?
There's a question from the chat.
Sure, go ahead, Tim.
If WHO have a policy on the neurological condition of COVID-19, is it compulsory that countries follow their policy, or is it discretionary? I live in Liverpool.
You live in Liverpool, aren't you?
Right. So in terms of the WHO strategies and policies, none of them are legally binding except for one. So does anybody know which is the legally binding treaty from WHO?
In terms of diagnosis or
anything, any health condition, any risk factor?
Don't tell us, we're going to get it collectively. Come on.
Something what is legally binding that countries sign on. There's only one treaty.
So again? Students' rights, FGM, keep going, come on. We're going to get there. Tuberculosis, HIV. Is it a specific disease or is it an area?
It's a risk factor.
A risk factor, okay, don't say any more. Smoking. Who said smoking?
Smoking.
Who was that? Put your hand up. Who was it? Where? There she is. Good. Smoking, well done.
So the tobacco treaty is only legally binding treaty. So none of.
How old is that one?
Now that I don't remember.
But it's not new. It's not.
It's not new. No. It's been around for many years. So that's if you sign on, then it's legally. Rest, even HIV, is not legally binding. So
Yeah.
so I think so. So what these global health strategies are for countries to adapt it to their context and use it in their settings.
Right. Question at the back. Yeah. Repeat the question.
Yeah, no, I will repeat the question. I'm glad that you asked this question, that as a young person starting now, how can you influence policy other than the clinical care and research work that you are doing? So a couple of ways that you can do it. One is you need to be advocate with your policymakers, because policymakers, if you have ever seen a health minister or a civil servant who's managing health, you would have one day one delegation talking about, oh, I come from mental health area, it is important. I come from diabetes, I come from cancer, oh, I come from meningitis, I come from HIV, I come from TB, I come from malaria. They need to understand that if you're talking about neuroinfections or you're talking about neurological conditions, why they are important. So you need to have numbers on your fingertips. So that's one thing that you need to know. And we call this the elevator speech, the 30-second elevator speech. So the advocacy is very important. And that's about how do you use the data, the numbers to advocate for. The second the important thing that you need to do is to translate the work that the evidence that you have from clinical care and research into messaging, into policies that the countries can implement. So for example, you have done, I talked about sequelae studies. So let's say that, okay, 20% of people who were part of this brain infection global cohort had some sequelae. So what is their policy message? That these had hearing defects, hearing problems, they had other physical defects or other issues that come in. So what as a policymaker that you need to do is you need to have a surveillance system to detecting the sequelae, providing services for those sequelae. So it's about the second thing that you need to do is to translate your evidence into clear messaging, clear solutions that policymakers can do. The third thing, that even the research that you do could be answering some of these policy questions. So you could be doing implementation research. So how can these interventions be implemented? Who can implement these? How can they be done? So these are some of the ways that you can take forward the policy work in your countries.
Thank you. Other questions, comments?
I've got another one from the chat.
Sure, go for it.
Would you prioritize working on any of these diseases or group of diseases? What do you believe it is more important to start prioritizing, for example, in Latin America?
So the question is about how do you prioritize for policy making, which health conditions?
That's how you're interpreting it. I think the question also had an element of which do you personally feel is the most important, but being a politician, I'm not sure you'll answer that.
So now policy making and prioritization is a tricky business. It's not very easy. And what is helpful is to have a set of criteria that can help. So the first set, okay, which conditions to prioritize in your country or in a region? What is the burden due to those health conditions? What proportion of like the numbers are we seeing? Population is being impacted. So I think that's your number one thinking in terms of the burden, and that's where I presented the global burden of disease data. You can have your country specific data. Second thing is how much of the cost it is due to the health systems, to the social care systems, to the families, because that directs policy making. So if policymakers, they feel that this is very costly, this is going to impact the economies, they are likely to invest. The third criteria that comes in is what can be done about it. So what are the interventions available? What is the cost effectiveness of those interventions? And the fourth thing, which is important, is what is the acceptability of the strategies to the population? So any prioritization exercise that you do, that it is important that you bring a range of stakeholders together, have a consensus process, including people who are affected by those health conditions, and then decide. Now, there is no one size fit all. Mm-hmm. Depending on how you interpret each of those criteria, different groups may decide differently. But having a set of criteria and having that as part of your decision-making process and stakeholder engagement is extremely important.
Thank you. Yeah, on that, I'm just thinking, listening to your talk and then thinking about, stuff we've been involved with. So a bit like the young woman at the back, how do you get involved? And the first piece of research we did in Vietnam years ago showing a polio-like illness due to Japanese encephalitis, which was quite important given it was the middle of the polio eradication campaign. So we published it in the Lancet, and then I've sat there in Vietnam for a week, 2 weeks, 3 weeks, thinking it can only be a matter of time before someone from Geneva gets in touch, says this is really important, how we're going to use this information to help us control polio eradication. And for Jay, it doesn't happen. You have to be the person, you have to be the advocate. And I also agree that involving the patient support groups is really important. And all of our work, you saw the encephalitis work, which is now part of the WHO program, came from the Encephalitis International working with us clinicians and academics and saying we really have to push on this. So I do think clinicians, you know, even people aren't doing research, if you're a clinician, the thing is you're seeing the patients day by day. So clinicians are very good advocates compared to people who sit in offices and just move numbers around. So I think it's really, you know, inspiring to hear your journey from being a clinician all the way through into the policy piece and then having some of these major impacts. And I've been involved with the WHO for 25, 30 years. And I probably should have said this at the intro, but, you know, it moves at a glacial pace, if at all. And but the area that you've taken on, it's moving at an enormously fast pace and really making a big difference. So, and I think anyone who's had any involvement with the WHO will see that this is an area where things are really happening. And so, you know, we're grateful to you for your work in this area. And, you know, we're behind you 100%. But anyway, probably on that note, we should stop and say thank you very much again.